Ang tawag ni inay at payo ni tatay,
kulitan ni bunso kantyawan sa bahay.
mga alaalang kay saya,
nagbibigay buhay. Ang distansya may bitbit ay alaala.
pinaglayo ng panahon o sa ibang himpapawid.
Sa tinig ko at tinig mo,
Dama ang pag-ibig, boses ang pag-ibig ngayong Pasko.
boses ang regalo ng buong Pilipino.
Malayo man hindi hadlang upang maramdaman
ang liwanag ng Pasko. Ang tanging hiling ko ngayong Pasko,
makita ang ngiti at masayang tawanan, kasamang mga taong mahalaga at malapit sa aking puso. Hindi magpapatalo sa anumang hamon,
basta't ang puso ko ay may pag-asa.
muli tayo'y magkikita rin, magkahawak, magkayakap.
Boses ang pag-ibig
Ngayong Pasko, boses ang regalo ng buong Pilipino. Malayo man hindi hadlang upang maramdaman ang liwanag ng Pasko.
May mga bagay na hindi mapabalik, mga pagsubok na daan na kayang harapin, pero dahil sa suporta at pagmamahal, iyong madarama ang pag-ibig na wagas. Isa ang mensahe ng Pasko sa ating lahat na bibigay sa kapwa na walang hinahangad. Iaaw sa bibig mula sa tinig na taglay, ang regalo ng Diyos sa inyo ibibigay.
Bawat tinig may dalang lakas, isisigaw sa mundo, babalik sa Diyos, babalik sa Diyos, babalik sa Diyos. Boses ang pag-ibig ngayong Pasko, boses ang regalo ng buong Pilipino. Malayo man hindi hadlang upang maramdaman. Boses ang pag-ibig ngayong Pasko, boses ang regalo ng buong Pilipino. Malayo man hindi hadlang upang maramdaman. Sa boses ko nakita ang aking pag-asa, sa boses ko nahanap ang isang pamilya. Malayo man hindi hadlang upang maramdaman ang sinasabi ng pusong nagmamahal. Salamat sa pagliwanag ng Pasko. Boses ang pag-ibig ngayong Pasko, boses ang regalo ng buong Pilipino. Malayo man hindi hadlang upang maramdaman. Liwanag sa boses ko nakita ang pusong nagmamahal. Salamat sa pagliwanag ng Pasko. Salamat sa pagliwanag ng Pasko.
Are you ready? Are you ready for the comeback? Yeah.
CVAP Certified Voice Artist Program.
Are you ready? Yeah.
It'll run for 4 consecutive Saturdays from 9 a.m. to 4 p.m. And an additional Saturday will be allotted for the virtual graduation. Learn more beyond the art of voice acting through the program. Held by the voice master Pocholo de Leon Gonzalez and other CVAP graduates who are now thriving in the industry.
Are you ready? Yeah.
CVAP is 50% off. From 10,000 pesos, the workshop is now priced at 5,000. The workshop is purely held online via Zoom. Scholarships are also available. Visit www.certifiedvoiceartist.com to learn more about CVAP and to register. Someone out there needs to hear my voice. CVAP Certified Voice Artist Program. Atomic Voice, Lloyd Lotharico. I am a CVA Certified Voice Artist.
Every morning before I go to work, I use my Trident Gold mouthwash. Ginagamit ko to kasi mabisang pag-uksa ng unang bakterya. Subukan ninyo.
Good morning. I'm Dr. Joseph Lee. Every morning I hydrate myself with natural soft spring water from Turkey. It is a soft water with low sodium and enriched with ozone. Eric Lee. I love my coffee.
VG8 Radio. 9, 8, 7, VG8 Radio. 5, 4, VG8 Radio. 2, 1. VG8 Radio. The voices of greatness.
This is the Sunday Health Show.
Powered by VG8 Radio.
Hello everyone! Great day po sa inyong lahat. Welcome back to show kung saan health is wealth, the Sunday Health Show. Okay, I am Mitzi Aguinaldo, the voice royalty, and before we start, we'd like to give thanks for the support of Genesis Organic Spirulina, Air Clean Natural Spring Water, Trilodent Gold, Salvicare Coffee, Regime Tolentino Atelier, Asian Hyperbaric Healthcare Institute, and Emergency Rapid Assistance App. We are currently live at the VG8 Radio Facebook page, the Sunday Health Show Facebook page, and VG8 Radio YouTube channel right now. And good morning po! Isang magandang umaga po sa inyong lahat. It's another Sunday yet again to share a new set of health information to our beloved viewers. So welcome to the 7th episode of the Sunday Health Show. It's our second to the last episode na guys. So, and how are you? Because we have 6 days till Christmas. So, sana okay po tayo ngayon no, na magse-celebrate ng Christmas, magkakasama-sama. And of course, the Sunday Health Show, on behalf of the Sunday Health Show, we would like to express our thoughts and deepest prayers to all of our fellow citizens sa Visayas and Mindanao. Kasi we all know na dumaan po yung bagyo, ang Odette, and we would like to let you know na we are one with you. Pero yung mga Pinoy po natin, alam naman natin na we can always remain strong, steadfast, despite the setbacks we experience, diba? And of course, we come back always with a smile, diba? Kahit na kung anong unos pa yung nararamdaman natin, nakasmile pa rin tayo, diba? Naulan na, nakangiti pa rin dyan sa gilid, no? Ganun tayo mga Pilipino, and that's what I love for all about us Filipinos. We remain resilient. So, yun lamang po. And sana maging okay po tayo ngayong Sunday. We celebrate our Sundays happy and kahit papano okay tayong lahat. Ayun lang naman po. So, and of course, to grace us again for this wonderful Sunday, here is our producer, main host, Kuya Doc ng Bayan, multi-awarded personality and celebrity urologist, Dr. Joseph Lee.
Good morning, Mitzi, and good morning, world. And of course, yes, indeed, like what Mitzi has said, it is indeed a great day, a rainy day, and a very, very staggering day because maraming nangyayari, pati mga internet natin ay sumasabay sa ating kalamidad. Oh, umalis na yung kalamidad natin so that, but it's raining this early morning, and I think of course when you have rains there is interruption of our internet system, so we have to bear with it, and you have to bear with us with that aspect. Now, of course, still like what Mitzi said, we have to continue giving you medical education through our show, the Sunday Health Show, because we have invited a very, very good resource person who will talk to us about the ins and outs of rehab medicine and therapy during and after the pandemic, right? Mitzi, okay. And
Yes, Doc.
here are some of our segment hosts to introduce to you, si Gian and Freddy. Good morning.
Yes, good morning po. Yan, sit back lang po tayo, relax, at bubusugin po namin kayo ng kaalaman bago kayo magtanghalian dito po sa ating Sunday Health Show. Once again, ako po si Freddy, ang inyo pong ka-Sunday Health Newsletter, at ihatid ko po sa inyo mga balita na pangkalusugan galing sa lokal at international scene. Ako po ay nandito po sa Kuwait, at ako po ihatid ko po sa inyo mamaya ang Omicron, ang pinakamalaking kasalukuyang banta sa ating World Health. At sa Bahrain, itinakda upang lumipat sa dilaw na alerto katayuan upang labanan ang COVID variant na banta. At ang karagdagang 500,000 doses ng COVID-19 na bakuna dumating na sa Pilipinas. At sa bawat episode ay tutulungan namin kayong ganap na maintindihan ang ilang medical terms. Walang iba, kasama natin si partner na si Jihan.
Okay po. So, sa ngalan ni Ate Jihan, she's trying to get in again po. Siya po ang inyong tagapaghatid ng MedTerm today, kung saan pabaon po ng The Sunday Health Show ang usual medical terms na madalas binabanggit ng ating mga doktor sa kanilang mga pasyente. Alamin sa ating MedTerm today ang rehabilitation. And para naman po sa pangkaragdagang kaalaman galing sa Sunday Health Show, meron po tayong approved yarn. Yan, of course, alam niyo naman po sa bawat episode ng Sunday Health Show, meron po tayong mga ibabahaging innovation sa larangan ng medisina, pati na rin sa yung mga medical apps na maaari po nating i-download at magamit everyday sa ating mga gadgets. Kaya abangan po kung ano yung ating approved yan for today's episode. And of course, kung meron tayong balitang kalusugan galing kay Nurse Freddy, pabaon na medical terms sa MedTerm today kay Ate Jihan, and of course, yung pangkaragdagang kaalaman patungkol sa medical apps or bagong innovation sa larangan ng medisina, hatid naman po namin sa inyo ni Doc Joseph yung malalimang usapan sa kwentong kalusugan. So, ito yung malawakang usapin po tungkol sa aming napili na topic ngayong linggo, and we all know how the Sunday Health Show advocates getting the right information from the expert mismo. So, kaya abangan po natin yung diskusyon patungkol sa Rehabilitation Medicine during COVID pandemic by Dr. Ronald Cua. Okay. Okay, sana makapasok na po si Ate Jihan. Hello, fam. Good morning. Magandang umaga po sa inyo.
Ayan.
Ayan. Hi, Doc. Good morning.
Yes, good morning. Yan ang sinasabi, no? Because we are live, yan ang nakikita natin, mga intricacy, no? It's raining today, so our internet system is way following the raindrops. Intermittent.
Oo
Diba?
nga po.
Oo. Anyway, we can probably start with Freddy's news, no? Kung meron na siyang ambag para pakinggan natin kanyang balita as we follow Gian later.
Alright.
Yes.
Okay, so, and there we have it po.
Yan, magandang umaga po sa inyong lahat. Bago tayo umarangkada, alamin muna natin kung ilan na ba ang bilang ng COVID-19 sa buong mundo. Alam nyo bang umabot na sa 274 million? At sa Pilipinas naman ay 2.84 million. Para sa ating pandaigdigang balita, hinggil sa kalusugan. Omicron, pinakamalaking kasalukuyang banta. Ito ay dinhatid ng World Health Organization, sabi ng G7. Ang G7 galing sa London noong Huwebes ay sinabing ang Omicron ay isang pinakamalaking kasalukuyang banta sa pandaigdigang pampublikong kalusugan at sinasabi ang paglitaw nito ay nangangahulugan din na mas mahalaga ito kaysa dati sa pag-iingat para sa mga bansa na malapit na nakipagtulungan. Malalim na nababahala sa pamamagitan ng pagtaas ng mga kaso ang mga ministro at sila'y sumasang-ayon na ang mga pagpapaunlad nito ay dapat makita bilang pinakamalaking kasalukuyang banta sa pandaigdigang publikong kalusugan, sabi ng Britanya sa isang pahayag. Sinabi pa nila na ito ay isang mahalaga na kailanman upang malapit na sa pakipagtulungan at subaybayan na rin pati ang pagpapabahagi ng mga data nito at ang mga ministro ay nagsabi rin na pinapaaga na gaganapin ang kanilang huling pulong na naka-host sa Britanya. Nakakita sila na ang rate ng kaso sa paglipas ng mga nakaraang araw nagrehistro ang mga numero sa record noong Huwebes. Ang mga ministro ay nakatuon sa pandaigdigang pag-access sa mga diagnostic, genome sequencing, bakuna at therapeutics sa isang bid upang labanan ang pagkalat nito. Samantala sa Bahrain, sa ilalim ng sistema ng liwanag ng trapiko ng Bahrain, ang paglipat sa dilaw ay pinahihintulutan kapag ang rolling average ng positibong mga kaso ng coronavirus sa intensive care unit ay 51 hanggang 100 kaso sa loob ng 7 araw. Ang isang pahayag sa Bahrain News Agency na nagsabi na ang task force ay na nabanggit ay may panukalang batas sa mga pag-iingat na ibinibigay ang option ng Omicron na hindi kakalat sa Bahrain. Ito ay desisyon na kinuha alinsunod sa maingat na diskarte ng kaharian ang pag-prioritize o ang priorisasyon sa pampublikong kalusugan sa pamagitan ng proactive planning at alinsunod sa international na pinakamahusay na kasanayan. At sa ilalim ng alituntunin na dilaw na alerto, ang mahalagang sektor ay nananatiling bukas para sa lahat, kabilang ang mga hypermarket, supermarket, mga tindahan ng grocery, mga pribadong klinika sa kalusugan, mga istasyon ng gas, bangko, mga sentro ng palitan ng pera, distribution o import or export, mga tindahan ng auto repair, construction, pabrika, operator ng telecom at parmasya. Habang ang mga empleyado ng pamahalaan ay bibigyan ng trabaho mula sa bahay na naangkop lamang sa patakaran hanggang sa 30%. At sa balitang lokal, karagdagang 500 doses ng COVID-19 ng bakuna ng AstraZeneca dumating na sa Pilipinas. Hindi bababa sa 500,000 doses ng COVID-19 na ginawa ng AstraZeneca ang ipinagkaloob ng pamahalaan ng Argentina ang dumating sa bansa noong Biyernes. Ang state-run People's Television Network ay nagpalabas sa telebisyon sa pagdating ng isang flight sa Singapore Airlines na nagdala ng bakunang anti-coronavirus sa Ninoy Aquino International Airport. Nakatanggap ng mahigit ng 10 million doses ng COVID-19 na bakuna na kinabibilangan ng mga donasyon mula sa ibang bansa at pagkuha ng ating pamahalaan. Ang pinakabagong donasyon mula sa Argentina ay nagtulak sa kabuuang stock ng bakuna laban sa COVID, mahigit ng 178 million, at ang bansa na nagsimula sa isang napakalaking biyahe sa pagpapabakuna sa isang bid upang makamit ang tinatawag na kawan o herd na kaligtasan sa sakit sa lalong madaling panahon. At yan ang kabuuan ng ating balita sa linggong ito. Muli ito si Freddy, the mellow voice, nag-uulat. Yan. Nakamute si Mitch.
Nakamute ka, Mitch.
Hello po! Ate Jihan, are you there?
Yes!
Ayan.
I'm here.
Ayan.
She's there.
Finally.
Mas.
Difficulties a while ago.
Oo nga. Okay. So, what can you say po sa news natin for today? Right.
I
So-
think we have to really be always on guard, no? Have ourselves vaccinated, follow the health protocols because any variant besides Omicron in the next few years, we just have to be safe. You know, we follow what the WHO and of course our Department of Health that is telling us or relaying us with regards to the health protocol, no? If we need to be booster, magpa-booster, no? Then we can protect ourselves, our family, and our country because we will create a strong shield. Hindi na talaga herd immunity. Parang biliba sa herd immunity, strong shield to prevent any variants from coming in, no? Besides the Omicron. Kasi we have Omicron that came in, tapos ano naman siya negative naman afterwards and asymptomatic naman mga pasyente because we will be getting a lot of influx of OFWs and foreigners coming in and out. So hindi mo maaalis yan, di ba? Yun lang ako yun lang ang statement ko. You guys?
Okay. For me naman po, doon po sa magkarugtong din po yung balita nung unang balita ni Sir Freddy about sa UK po, no, tsaka dito sa Pilipinas. Hopefully, same as Doc Joseph po. let's pursue on having everyone vaccinated nga rin po. And sabi nga nung sagot ni Miss Bea Luigi Gomez, 'di ba? Baka mamaya gawing passport po, no, yung may lahat kailangan may bakuna na. So mahirap,
Yes.
no, pag wala tayong bakuna, di tayo makakapag-travel. So
Mm-mm.
might as well get it na, guys. Huwag na po tayong magpalit. Yun. So, you,
At
Ate G,
ano
po.
at Mitzi yung mga hindi magpapabakuna, utang na loob, ito dahil sasabihin ko sa show natin huwag kumuha ng fake vaccine card. Huwag magpagasto
Ay!
sa mga nagbebenta.
Meron na nga.
Ay!
Oy, meron na yan. Oo. Naglilipanan yan. Alam mo, you think of others, no? If you do not like to be vaccinated, you just stay still. Stay still and
Diyan
healthy.
ka na lang sa pwesto mo,
Huwag
ganon.
ka na gumawa ng mga ibang kababalaghan. At the end of the day, if you have a fake vaccine card, lalabas yan sa vaccination certificate mo Hindi ka naka-register. Di ba?
That's
Tama.
true.
Yun lang.
Yes, tulad po nung experience ko din po, may pasyente ako kagabi. Admitted siya, isa siyang Syrian national. Then, mayroon siyang symptoms and then sabi niya, pwede niyo ba akong vaksinan ngayon? Di ba? Parang, huli na, nandito ka na nasa hospital ka na. Then,
Gamot na yung bibigay sa'yo.
gagamutin ka na kasi positive siya. I'm sure he's positive. Then may isa rin akong kakilala, sabi niya, never ako magpapavaccine. Okay? So since we started ang vaccination natin dito, kasi nga meron siyang naririnig ng mga negative things na kesyo it's from 666 or whatsoever. What? And then finally, natanggal siya sa work niya. Ngayon hindi siya makapasok kasi sa Kuwait, automatic po yan pag hindi ka na vaccine, wala kang vaccination, mahirap pong pumasok sa trabaho, especially pag mga expats. Yan siya. So, masasabi ko lang yun, nasa sa inyo. Kung gusto niyo talaga ng mas makulay na buhay, magpabakuna na po tayo.
Love it.
Diba?
Yes,
You,
sa akin
Ate
naman,
Jihan.
sorry, yes. Sa akin naman, ngayon, holidays na, so, lahat ng tao, magkukumpulan, tendency nila is magkumpulan. Kahit na po nagpa-vaccine na po tayo, we can still carry the virus and meron pa pong iba na pwedeng mahawa, so we have to be very careful. And as much as possible, try natin magtiis muna na mag-stay muna sa bahay at magkanya-kanya muna. As much as possible, mag-ingat and tiis muna ng walang celebration habang nandyan pa yung virus, habang hindi pa lahat cured and nagpa-vaccine.
That's true. Ayan. Napaalalahanan na po tayong lahat. So, ilang beses na po yan sinasabi kahit saan po dito sa Pilipinas. So, mag-iingat and magpa-vaccine na po. Yun lamang po. Alright. So, okay po. Ayan na nga po ba? Susunod na po. Ang pag-uusapan na po natin ang ating midterm today, ang rehabilitation. So, Ate Jihan, let's discuss our midterm for today.
Our midterm for today is rehabilitation. So what is rehabilitation? Rehabilitation is a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. Put simply, rehabilitation helps a child, adult, or older person to be as independent as possible in everyday activities and enables participation in education, work, recreation, and meaningful life roles such as taking care of the family. It does so by addressing underlying conditions such as pain and improving the way an individual functions in everyday life. supporting them to overcome difficulties with thinking, seeing, hearing, communicating, eating, or moving around. Anybody may need rehabilitation at some point in their lives, following an injury, surgery, disease, or illness, or because their functioning has declined with age. Some examples of rehabilitation include exercises to improve a person's speech, language, and communication after a brain surgery, modifying an older person's home environment to improve their safety and independence at home, and to reduce their risk of falls. Exercise, training, and education and healthy living for a person with a heart disease. Making, fitting, and educating an individual to use a prosthesis after a leg amputation. Positioning and splinting techniques to assist with skin healing, reduce swelling, and to regain movement after burn surgery. And prescribing medicine to reduce muscle stiffness for a child with cerebral palsy. Psychological support for a person with depression, training in the use of a white cane for a person with vision loss. So, what are the benefits of rehabilitation? Rehabilitation can reduce the impact of a broad range of health conditions, including diseases, acute or chronic, illnesses, or injuries. It can also complement other health interventions such as medical and surgical interventions, helping to achieve the best outcome possible. Rehabilitation is an investment with cost benefits for both the individuals and society. It can help to avoid costly hospitalization, reduce hospital length of stay, and prevent readmissions. Rehabilitation also enables individuals to participate in education and gainful employment, remain independent at home, and minimize the need for financial or caregiver support. Rehabilitation is an important part of universal health care coverage and is a key strategy for achieving Sustainable Development Goal 3, which is to ensure healthy lives and promote well-being for all at all ages. The misconception of rehabilitations are rehabilitation is not only for people with long-term or physical impairments. Rather, rehabilitation is a core health service for anyone with an acute chronic health condition, impairment, or injury that limits functioning, and as such should be available for anyone who needs it. Rehabilitation is not a luxury health service that is available only for those who can afford it, nor it is an optional service to try only when other interventions to prevent or cure a health condition fail. For the full extent of the social, economic, and health benefits of rehabilitation to be realized timely, high quality and affordable rehabilitation interventions should be available to all. In many cases, this means starting rehabilitation as soon as a health condition is noted and continuing to deliver rehabilitation alongside other health interventions. Atin namang alamin kung anong app or innovation sa Approve Yarn. Ito naman ang isang medical app na pwede nyong gamitin, ang Bearable Symptoms and Mood Tracker. Bearable enables patients to regain control of their health by keeping the mood and symptoms monitoring easy, comfortable, and available to everyone. Entry into our wellness diary is fast and effortless, so you can spend more attention to feeling healthier. Ang pag-track ng inyong mood at symptoms at iba pang mga daily factors ay makakatulong sa atin. May mga panahon na mas madali natin matatandaan ng mga ito para mabigyan tayo ng mabuting assessment ng ating mga doctor or therapist. Ang Bearable app ay ginawang simple ang proseso ng pag-track ng ating mood nang walang komplikasyon. Maaring ma-track sa Bearable ang mood and symptom entries, pati na rin ang ibang health factors kagaya ng sleep, diet, exercise, medication, supplements, at iba pa. So isang app na para convenient, effortless at simple ang pag-input ng mga entry process para ganahan ang mga gagamit nito na mag-log ng entry everyday. So yan, so pag halimbawa naging marupok kayo today, pwedeng ilog at kwentong kalusugan naman na susunod after a short break.
Good morning. I'm Dr. Joseph Lee. Every morning I hydrate myself with natural soft spring water from Turkey. It is a soft water with low sodium and enriched with ozone. Eric Lee. I love my coffee.
Gargle with Trilodent Gold Organic Mouthwash 30 seconds before brushing your teeth. Made from fast-active organic ingredients that help whitens your teeth, prevents gum disease, cavities, and refreshes breath. Trilodent Gold, raising oral health care standards naturally.
Magandang araw! Nahanap ko na ang food supplement na makakatulong para sa pag-increase ng aking immune system. Ang Genesis Organic Spirulina. Ang Genesis Organic Spirulina ay gawa sa blue-green algae na mayaman sa vitamina at mineral. Ang spirulina ay tinatawag ding superfood kasi marami itong nutrients na nakakatulong sa pag-boost ng ating immune system. Maliban dito ay meron itong ORAC value na katumbas na 24,000 unit na mas mataas pa sa mga berries. Ano ba ang health benefits ng spirulina? Nagpapalakas ng aking immune system, so hindi na ako masyadong sinisipon. Nakakataas ng ating resistensya sa pag-combat ng mga bacteria at sa mga virus. Effective antioxidant o yung sinasabi natin cancer prophylactic. Kahit nang wala akong history ng cancer, para sa mga pasyente ko pag piniprescribe ko na yung mga may history ng cancer, at least nakakatulong siya. Natural cleansing and detoxification. Nakakatulong at nagbibigay ng enerhiya sa akin sa araw-araw ng aking pagtrabaho, sa araw-araw ng mga schedules na natatambakan ako, ay nakakatulong talaga ang Genesis Organic Spirulina. So, subukan niyo na at uminom na rin kayo ng Genesis Organic Spirulina.
Hello, Doc. Good afternoon. We're back.
Yes, Mitzi, we are really back. This is our second part of our show, which is the parang sabi natin this is where we will interview, not really interview, talk to our special guest. So, sino ang guest natin ngayong hapon, Mitzi? Your honor of
Yes.
introducing him.
Opo, all right. So let me introduce our guest for today. Okay, so our guest for today had his residency training in Apolinario Mabini Rehabilitation Center, a Department of Physical Medicine and Rehabilitation at University of Santo Tomas, Hospital España, Manila, Philippines. He had his postgraduate internship at Cardinal Santos Medical Center at Green Hills, San Juan City, Metro Manila, Philippines, and his postgraduate education at University of Santo Tomas again. And he had his postgraduate training and fellowships at National Taiwan University Hospital, Department of Physical Medicine and Rehabilitation, and ASAN Medical Center, Department of Physical Medicine and Rehabilitation at Seoul, South Korea. Wow. So our guest for today is of course a specialist of the physical medicine and rehabilitation. Let us now call him na Dr. Ronald Christopher A. Cua. All right. There we go.
Hello.
Yon.
Hi. Hello. Good afternoon.
Hi.
Good afternoon.
Yes, good afternoon.
Dr. Joseph Lee. Good afternoon,
Yeah.
Ma'am Mitzi. It's a pleasure to be here.
Yes, it's our pleasure, Doc Ron. Di ba para siyang membro ng BTS.
Oo nga, natawa ako. Sabi ko, parang when I was reading actually yung South Korea, no? Parang he's from South Korea, no? But he's Chinese. He's Chinese.
He's Chinese. Okay.
Alright. So, who goes first, Doc?
Ikaw na muna. Tanungin mo. Kasi, ang title niya is, you were saying, Mitzi, physical
medicine and rehabilitation.
And rehab. Most of the time, we know rehabilitation medicine. So, what is physical medicine? No? Let us ask Doc Ron, what is that all about? Kasi, pag rehab, alam mo naman, we want to restore what has been probably damaged for a while, or some of our muscles or joint that has been dysfunctional for a certain period. But what is physical medicine, Doc Ron?
Actually, the name of our specialty is physical medicine and rehabilitation. Now, it's also known as physiatry, not psychiatry. Physiatry.
Physiatry.
A lot of patients and a lot of people are confused with those two terms. So we are also called physiatrists, and actually we are a branch of medicine that aims to enhance and restore functional ability and quality of life to people with physical impairments and disabilities. We're called physical medicine and rehab specialists because aside from the medications and the pharmacologic treatments that we provide to our patients, we also use and utilize physical agent modalities in order to heal and help restore the function of our patients. Now, these physical agent modalities would be doing your physical therapy. For example, when you do your physical therapy, we use a lot of equipment to help loosen up the joints, reduce inflammation, improve muscle and tendon regeneration. And aside from that, we also utilize a lot of exercise. No, exercise for us is medicine in itself. So that is actually a very important part of our practice and our specialty. So what I usually advise to our patients, pinapag-exercise po namin talaga sila para gumaling po sila at bumawas po ang recurrence ng sakit.
So what is the thin line that really differentiate your physical medicine from rehab? Because Mitzi, di ba, Doc Ron was saying that quality of life, good, okay yan. We
Mm.
go to its normalcy. But when you say rehab, parang ganun rin, no? But what
Yeah.
is the thin line that really differentiates to the both branch of medicine, no? This is for our viewers and those who are
Yes,
listening.
yes.
Kasi sometimes they're confused eh. Doc, punta daw ako sa
Yeah.
physical medicine. Doc, punta ako sa rehab. Ano ba? Yung kasi they might uh, crisscross to each
Interchange.
other. But
Yes.
Yeah.
what is the element of rehab and what is like what you have explained now with physical medicine that at least alam ng ating mga pasyente, o ito rehab to ha, ito physical medicine.
It's actually basically ano no doc. I know a lot of patients are confused, but
Yeah.
it's basically the same because
All right.
in terms of how we do rehabilitation with the patient, that's
Mm-hmm.
the time that we use our medical pharmacologic treatments and
Mm-hmm.
physical treatments. So it
Mm-hmm.
basically comes hand in hand.
Mm-hmm.
It's basically the same. That's why our
So,
specialty is ano, some departments, some hospitals, they call us rehabilitation medicine lang, rehabilitation medicine
uh,
department.
Mm-hmm.
It depends actually in the country of origin then, no?
all
In the
right.
United States, normally it's physical medicine and rehab.
All
Here
right.
in the Philippines, since our education is closely related and closely patterned to that of the United States style of medical
Rehab.
education, majority of the departments here, hospital departments, are called physical medicine and rehab department.
All
Some
right.
hospitals, ano lang, rehabilitation medicine
Rehab.
department. Yeah. So
So
basically,
interchangeably yung
yes, yes,
terminology. Okay, good.
Terms.
So klaro yan sa ating mga
yes.
listeners at mga okay,
Okay.
Mitzi.
Okay. At least gets na. Pati ako,
Oo.
gets ko na rin
'Di
siya.
ba? Kasi baka
Yeah.
ma-confuse sila, lalong
Might be,
ma-confuse, ang
yes,
hirap-hirap and that's the
yes.
same doctor in itself, no. We usually
Yeah.
explain to them Doc Ron, especially if you have new titles or specialty so that our
Yes.
viewers can understand, 'di ba Mitzi? Kundi
Opo.
maguguluhan sila parang
Mhm.
bago ba to? Pero pag iisipin mo like what Doc Ron said, they're interchangeably and sometimes
Mm-hmm.
you use them depending on how the institution or the
Yes.
country is terms are with regards to the division of in the medicine. Okay, Mitzi?
Yes, parang yung ano po, previous guest po natin, no, urogynecologist, the difference
Oo.
between OB-GYN and
Remember?
urogynecologist.
'Di ba?
Yes.
Mm-mm.
Opo, ayan. So, Doc, as said kanina po sa med term today namin earlier, sabi, yeah, rehabilitation can reduce the impact of broad health conditions. So,
Yes.
let's relate this naman po sa COVID in this
Okay.
pandemic kasi 'di ba our title is Rehabilitation Medicine during COVID pandemic. So, what are the common therapies usually done ngayon pong pandemic?
Ngayong
Yung mga
pandemic.
nare-receive nyo po.
Okay. Actually, during this pandemic, normally our specialty is a referral specialty.
Mm.
Kumbaga, we're not the first line who see the patients, no?
Mm-mm.
But as the COVID pandemic went through and the way it affected our lives, actually, we received several patients. Kumbaga, with the COVID pandemic, even the ones that are admitted in the hospitals, even the COVID
Mm-mm.
patients,
Mm-mm.
majority of them needed rehabilitation also.
Mm-mm.
No,
Mm-mm.
so COVID-19 initially it was a viral infection. Um, Kumbaga, nung una siyang lumabas, una nating inisip is respiratory, upper respiratory tract illness type of disease siya. But then again, as the disease progressed and as we studied more regarding COVID-19, we then realized that it's a multi-system disease. No,
Mm-hmm.
it can affect your respiratory tract,
Mm-hmm.
um, even your even the gastrointestinal system. Correct, doc? You have
Mm-hmm.
patients, COVID-19 patients with who present with diarrhea. It can also affect the hematologic system, our blood.
Mm-hmm.
The patients have they have hypercoagulable states, or in layman's terms, mas mabilis lang mag-clot or tumigas yung mga blood nila sa blood vessels. Aside from that, may mga nakikita rin kami mga pasyente na nervous system ang tinatamaan. Nagkakaroon sila ng critical illness neuropathy wherein nangihina yung buong katawan nila, including the musculoskeletal system. So, as the disease progressed and while the patients were admitted in the hospitals, their attending physicians, the frontline doctors, then saw the need for referral to the rehabilitation medicine service. No? Number one, for COVID-19 patients who were admitted under the critical state, no, moderate to critical state, wherein they need to stay in the hospital for a very long time, they need to lie down in the hospital bed with very little movement, nagkakaroon sila ng maraming complications din. No? A very common complication of prolonged immobilization would be the occurrence of bed sores. Nagkakaroon sila ng mga sugat sa buttock area, sa sacral area, doon sa heels. So
I'm
that's one
sorry,
thing.
Doc. Bed sores?
Bed sores.
Bed sores.
Bed sores.
Yeah,
Okay.
pressure sores. If you will be sitting for several hours without any type of movement, no, there are pressure points in our body that is very close to the bed. So those pressure areas masyadong namamacerate, so nagkakasugat sila. So that's one very common complication ng mga pasyenteng naka-admit ng matagal. Bukod po doon, nagkakaroon din ng contractures, tumitigas yung mga joints. And together with the joints, the muscles, tinatamaan na rin. Nag-atrophy yung mga muscles or lumiliit sila because of disuse. No? We also saw patients right after the COVID-19 infection wherein they are very healthy individuals, but then again, right after the infection and right after prolonged hospitalization, prior to the discharge, negative COVID swab na sila, nahihirapan silang tumayo at maglakad on their own. No? So severely affected talaga yung katawan nila. So that's the role of our specialty. Majority of these patients are then referred to us to recondition them and bring them back to their previous function. So that has been our role during this pandemic. Kasi most of the other lay people would think of the frontline workers will be the infectious disease specialists, the pulmonologists, the surgeons,
Yeah.
the anesthesiologists who will be doing the intubation, di ba po? But actually, lahat po ng specialties are working on COVID patients.
Right,
I'm correct,
right.
Dr. Lee, no?
Yes,
I'm very much correct.
Yes.
Halos lahat po tayo ay tinawag para tulungan po ang mga pasyenteng may COVID. So, that has been our role during this pandemic.
I just like to follow up
Yes.
the question of Mitzi, Dr. Ronald. Okay. If you have a referrals, especially for COVID wards, patients who have been long-standing in the hospital, I am just wondering for those who have been already in your what do you call that rehab schedules, no?
Yes.
Meaning they have been doing rehabilitation in your department. And since we have almost long haul of lockdown, hindi sila pwedeng pumunta sa hospital or yung clinics. So, how do you see them and how do you advise them, di ba? Mitzi, yung what we're saying kasi is like those patients who are already ongoing therapy. So, hindi sila makakapunta ng therapy. So, how do you look after them, no? Do you do teleconsultations or you ask them to do basic rehab stuff in the house? Paano yan pag wala sila mga gamit?
Okay.
I'm just wondering.
Yes, I understand. No, I see what you mean, doctor. Actually, for these patients, prior to discharging them, once these COVID patients are transferred already to the clean ward, which means negative COVID swab na sila. In our institution, that's the time that we start the rehab process of the patient, in such a way that we can discharge the patient properly, na at least man lang nakakaupo yung pasyente, nakakalakad ng konti. Then, that's the time, kasi we don't want to keep the patient very long in the hospital. Kumbaga, during the height of the pandemic, kulang din tayo ng hospital beds.
Yes.
As much as possible, once the patient is stable already, we want to discharge the patient. So, this is where our specialty needed to do a lot of tweaking and a lot of modification in terms of the context of our pandemic. A lot of patients would stay home. They would be afraid to go to the rehabilitation centers.
Right.
Although the rehabilitation centers in the hospitals, in the clinics remained open. No? But then again, there's this fear of, for COVID patients, there's this fear of recapturing the infection. They don't want to infect themselves. They don't want to infect their loved ones. No? And for those patients who are non-COVID patients, who are experiencing musculoskeletal disorders, they don't want to expose themselves outside.
Exactly.
No? They don't want to. So this is how our specialty evolved. We then went into teleconsultation, and then we went into tele-rehabilitation also.
Tele-rehabilitation.
Yeah, teleconsultation and tele-rehabilitation is almost the same. So I also do teleconsultation, wherein I evaluate the patient using video call. Correct? And I know it's really difficult, lalo na for our specialty. Kasi in our specialty is really physical, and we need to do a complete physical examination. We need to really inspect, palpate, check the muscle strength of the patient. Kailangan ma-check namin manually. Kailangan makita rin namin kung paano siya magkakad. So whenever we do tele-rehabilitation and teleconsultation, a strong support system from the family members is actually very important. No, from the family members and from the caregivers, because they're the ones who are going to help you examine the patient. No, lalo na for a patient with severe weakness who really cannot simply raise his or her arms. You ask the caregiver or the relative to help you out in examining the patient. Aside from that, the exercises in itself, some of them with really severe weakness, someone has to do the movement for them. This is where the caregivers would come in, no? Because the caregivers and the family members would be their support system. They're the ones who are going to help move the patient, no? Now, when we do the tele-rehabilitation, actually, it's being streamed by our physical therapist, no? Gusto ko rin maintindihan din ng ng iba nating mga viewers at iba ng mga pasyente na in rehabilitation medicine, we work as a team. Hindi lang po ang physiatrist or the rehab med doctor. Actually, kami yung head ng rehabilitation team. We have a lot of very important and key members that are working with us. No, we have the physical therapists who are there to help restore movement, gross motor movement, and help move the patient. No, we have the occupational therapist who would deal with the fine motor movement, activity of daily living training. Activities of daily living would be described as yung mga essential na ginagawa natin, like pagkain. Yung iba nga nahihirapan kumain mag-isa, pumupunta sa toilet mag-isa, pumupunta sa banyo mag-isa, paglilinis ng sarili. So these are the activities of daily living that the OTs help the patient. Aside from that, the OTs also help with swallowing training. May mga pasyente rin na after COVID, nahihirapan lumunok ng pagkain. So we also get patients na ganoon. No? Hand in hand with the OTs, we have the speech language pathologists who also help with the swallowing and also help with speech and language training. Kasi we have patients then after the disease, nahihirapan magsalita. They have a dysfunction with their nervous system, specifically with the way they talk. So that's where the speech language pathologists come in. In an ideal setting, meron pa pong mga rehabilitation nurses and mga psychologists. No, who would help. Yes. Yes, Dr.
I'm just wondering, di ba, Mitzi, kasi sabi ni Doc Ron no, tele-rehab, okay. That's a new thing
Yes.
sa ears ko, no. It might be very difficult, Doc Ron, for patients who
Yes.
cannot follow
Yes.
directions
Yes.
very clearly, no. Parang if you explain to them this one live, or you have the group of team, sometimes even the relatives of your patient might be confused on the instruction. I'm not saying in general, in ano, but sometimes you can have one or two, right, patients who are more or less difficult in instruction.
Yes.
So with the tele rehabilitation treatment that you have with your team, do you have a already recorded tape of treatment that they can have and they just have to follow? Kasi minsan, Doc Ron, di ba? Minsan kukulitin ka. Doc Ron, parang di ko yata, mali yata ang ginawa ko. It seems like this is wrong and I'm experiencing more pain. Di ba, Mitzi? Parang
Yes.
hindi mo alam kung mali ka or you're not following instruction.
Yes.
Kasi minsan,
Yes.
wala rin,
Proper
wali.
form,
Yeah,
ganun,
Parang
proper
ano
form.
no?
no?
Yes,
Parang,
I understand.
parang, parang, you do this, you do that. No, Mr. Select. So, you cannot keep on doing this, Doc Ron, kasi you have other patient. Baka
Yes.
yung instruction pa lang, failure to follow, abutin ka ng 3 oras. Ano bang, di ba? You cannot, you get me? So, I was asking, Doc Ron, Mitz, kung meron silang pre-tape para doon sa
Mm.
medyo mabagal na mag-follow, or you just have to follow this, you do this.
Yeah.
Then you come back to me through teleconsultation. Do you have pre-tape
Okay. Ideally, tele-rehab, with the, for example, with the physical therapist and with the OT, ideally it's supposed to be done live, just so
All
that
right.
there is live feedback,
Interaction.
interaction with the patient and the
All
therapist.
right.
Ideally,
Yes.
it's supposed to be done like that.
Mm-mm.
If the patient's relatives would ask the physical therapist and the OT, usually tatanungin nila, Doc or Sir, okay lang po bang i-record namin ito? Para at
Yes,
least we
oo.
have a guide.
Ganyan.
Normally, we would allow that naman. Because
Okay.
they will be using it personally naman within their household, within themselves. They're not going to, as long as they're not going to broadcast it, because of course the treatment that we do is specifically for one patient.
Yeah.
Yes,
Hindi siya,
Opo.
yes.
it's not good for
Agree.
everyone.
Oo,
No? It should
agree.
be patient-directed, individualized treatment. Hindi
Agree.
pwedeng one size fits
Hindi
all.
pwede kopyahan.
Hindi pwedeng
Yeah.
kopyahan.
Mamaya
That's
nasa
not,
YouTube na yung ano ni Doc, no?
yes. Yes. So, normally naman, our patients would allow us to do that. Now, in cases wherein the patient really has difficulty following and kailangan talaga ng physical intervention,
Yeah.
no? Believe it or not, even during the pandemic, we also did home-based rehab by sending a physical therapist to their house.
Oh.
Yeah, home-based therapy by sending a
Mm.
physical therapist and an occupational therapist to their house. But of
Wow.
course, we usually ask the family members, the
Yeah.
patient, and of course
Yes.
our physical therapist to
Yeah.
follow this very strict health protocols.
Uh-uh.
Even
Uh-uh.
the physical therapists, they wear the personal
Mm-mm.
protective equipment.
Yeah.
Kasi these physical therapists work with other patients.
Yes. Yes.
Some of them, they work in the hospitals.
Yes.
So, they go to your house, complete ang
Yeah.
equipment nila. And we also
Yeah.
ask the same with the patient. Ang minimum namin is, as much as possible, if we can do the treatment in an open space, kung may garden yung pasyente,
Yes.
where it is
Yes.
an open air space, doon namin usually pinapagawa yung treatment. In cases wherein the patients do not have the privilege of having an open space, we ask the family members and the patient to wear at least a face mask, a really good face
Mm-mm.
mask with adequate protection, just so that they will not get exposed.
Mm-mm.
So these are,
Mm-mm.
yes,
Mm.
sorry doctor.
You're correct, no? I'll just interrupt a bit. Tama ka, no? Because you do not like the relatives or the patient itself uh, to blame your therapist, no, or your physical or occupational therapist na, oy, baka kasi during the time, di ba, Mitzi, yung pandemic, parang masyado siyang isolated. Oh, so we're free of the virus. Dami biglang pumupunta yung therapist tapos na yung nag-COVID positive.
Yes.
Dinala nyo pala yan eh. Di ba? So, are
Mm-mm.
they also in their during the time, yung PPE and yung
PPE.
full geared?
Yes.
Or
Yeah.
they
Yes,
have
they're full.
sprays, no? Okay, good.
Yeah, they're full geared. They because studies have shown that once you actually have a face mask and the patient that you're treating is also wearing a really good face mask, the risk of
Mm-mm.
transmission is actually very low.
Yeah.
So as long as ano naman natin, the COVID-19 is actually easily spread if wala talagang face mask and really open and you're really in very close proximity to your patient. So so far actually transmission wise, I'm very happy to say na wala naman pong
Alright.
nahabang pasyente. the the physical
Uy.
therapists that that are doing the home-based treatment. But in the far-flung areas wherein there's limited accessibility
Mm-mm.
to a physical therapist, that's
Mm-mm.
where telerehabilitation would come in.
Mm-mm.
But then
Ah.
again, in the Philippines, Dr. Joseph and Ma'am
Mm.
Mitzi, alam naman natin, napakapangit ng hindi pa ganun kaganda ang internet connectivity in our country.
Oo.
There are other
Pangit
areas,
talaga, Doc
pangit
Ron.
talaga.
Oo. Diba?
Speaking of,
Yeah.
Speaking of, di ba, Mitzi, nagkaroon nga ng problema, o di ba? O, pangit
Oh
talaga,
yes.
Doc Ron. O.
There are areas pa na talagang there are areas here
Mm-mm.
na talagang wala pang internet connection. That
Mm-mm.
in itself will pose as a problem for us.
Yes,
Actually
yes,
for
yes.
all actually not just in the medical field, actually for everyone because actually internet connectivity is
yes.
an essential na.
Kailangan
Mitzi.
ng rehab ng internet.
Hindi ako bago ikaw isa lang masasabi ko para sa audience natin. I never knew for the last 2 years na sinasabi ngayon ni Doc Ron na there is home service therapy with wearing the full gear. Kasi inaano ko Mitzi before na parang ay wala. There are some specialties during the pandemic, 'di ba, Doc Ron? Either they don't come out, they don't receive patients or no, or they're restricted.
Mm.
Like sa amin sa surgery, hindi, yun during the time. Doc Ron, yung mga laparoscopic, gano'n, hindi pwede yan because
Yes,
they
yes.
have air
Because
vaporization
the
machine,
air
right?
is
Oh. So we
yes.
are restricted to do very minor surgical procedure. Very, very restricted on the top. Pero now listening to you, 'di ba, Mitzi, meron palang pumupunta pwede mag-therapy sa mga those who have been chronically ill and needs to be rehabilitated despite of this pandemic, that they don't need to worry in going to their hospital and
Yes.
visiting you, no? Okay
Yes.
lang pala yun.
Yes, it's
Mitzi?
okay.
Mm-mm.
Commute pala ako. I was also wondering, does rehab only apply to those who have illnesses? Pwede rin po kaya
Mm-mm.
to sa mga healthy individuals na gusto lang mas maging flexible, mas maging okay yung
Yes.
kasukasuan, galaw-galaw.
Okay. Basically, kasi with our specialty, we're medical doctors in a field treating a specific disease and disorder. What we noticed during the pandemic, masyadong confined din yung mga tao in their
Mm.
houses. They don't get to go out. They don't get to do their usual routine. Most of them are doing work from home. Um, Maraming gusto yon because they don't have to deal with the traffic and the stress. May
Mm.
iba, mas gusto na lang they go out. But the problem with working from home is that these types of workers tend to actually spend more time working. Halos wala
Mm.
nang tinatawag, no? Wala nang oras na uh, allotted specifically for work. Kumbaga, they're sitting in front of their computers for actually on the average 8 to 12 hours per
Yeah,
day.
more than, more
Yeah.
More
than,
than
more
pa,
than.
like
More than na.
typing, doing
Mm-mm.
office
Mm-mm.
work, and when
Mm-mm.
their bosses decide to just call for a meeting, tatawagin na lang sila kasi alam naman ng boss, they're just staying at home. Correct? So, this type of working setup, although advantageous to the patient, especially na hindi na siya magta-travel, could entail a lot of musculoskeletal disorders din. So,
Oh my God.
kadalasan dito sa mga pasyente ko nagkakaroon ng neck pain, nagkakaroon ng low back pain. So, the neck pain, there are several differential diagnoses. It could be degenerative disease of the spine, aggravated lang by prolonged computer work and poor posture. Nagkakaroon sila ng mga muscle spasm or myofascial pain. Some patients some patients they strain their low back area because of prolonged sitting. Because if you're seated na matagal, if you will notice, it's your buttock and your spine that is in very close contact to the seat. And if you will see, majority of your weight will be on your spine.
Yeah.
So the spine would receive much of the pressure that the gravity is doing on your body. It's actually pulling your body down. So these are the normal and the usual musculoskeletal conditions that our patients would complain. Of course, with regards to Mitzi's question, if a well patient can get our advice and our service, of course. Kasi what our specialty is preaching is exercise.
Naku.
We are exercise advocates, and we really encourage our patients to exercise. Even in the confines of their homes, marami silang magagawang exercise already. So, that's the answer to Ma'am Mitzi's question. Ang sagot sa mga tumitigas na kasukasuan sa mga pasyenteng wala namang sakit, we really advise them to exercise. But of course, prior to doing that, kailangan, if they have any underlying medical condition, maganda makita muna sila ng doktor.
Right.
Hindi na pwedeng, sorry po, doctor.
Diba ako, Doc, yung napakita ko sa'yo na Mitzi, sabi ni Doc yata baka MPS na stress-related. So I need to have 1 week rehab, at least once a week. Stress-related, Mitzi.
What's that,
Stress-related. It's stress-related.
MPS.
Yes, it's myofascial pain syndrome. It's actually one of the few muscle pain syndromes, purely muscle pain syndrome that the body experiences. In layman's term, ito yung sinasabi nilang may lamig na nararamdaman dito sa leeg.
Yes.
Diba?
Oh my gosh.
I'm sure Ma'am Mitzi, in a very stressful situation or if you're doing a lot of work and masyado ka na napapagod and nasi-stress sometimes, actually most of the time it's normal for us to feel na parang bumibigat yung balikat natin.
Yes, yung antigas-tigas niya.
Antigas-tigas. So that's what you call myofascial pain syndrome. Now, there are cases na if maganda ang support system ng katawan ng isang pasyente wherein sandali lang or transient lang lumalabas yan at madali siya nakaka-recover, well and good. But there are several patients wherein they are always stressed all the time and their coping mechanism is not so good. Tumitigas masyado yung muscle. No? It becomes a chronic condition. So if once it becomes a chronic condition, normally we ask the patients to undergo physical therapy already. So that's the time that we, after assessing the patient, we tell them, I think it's better for you to do rehab and physical therapy for your neck pain, just so that we can manually relax the muscles and manually stretch it properly. But aside from the physical therapy, the most important thing that the patient needs to do is activity modification and lifestyle modification. No, you should learn how to relax. You should learn how to relax.
Learn how to relax.
You should learn how to take breaks, and very important, you should allocate time to exercise.
But like this case, we pick a condition like MPS, which is very common.
Yes.
Is it true that para si Mitzi baka hindi natakot, this is for aging men like me, or it can happen to even as young age like Mitzi, mga 20s, early 20s, like that? Or this
Okay.
is like, for matanda
Feel
lang
ko
yan, di ba,
actually
Mitzi?
nararamdaman ko po.
Actually,
Feel ko.
ngayon meron ka siguro. um, with regards to myofascial pain syndrome, before, this can be experienced by anyone. We do also get pediatric patients na meron din myofascial pain.
Mm.
Lalo na ngayon, kasi
Pedia.
ang classes kasi nila is purely online.
Yes
Not
po.
like,
Oo,
it's,
pediatric.
believe it or not, it's also stressful for them. Not just for the parents, it's also for them. Because imagine, ang attention span ng bata ay napakaliit and napaka-short. And you're going to ask I think better siguro if we ask a pediatrician to talk about this. But imagine yourself, your younger self, learning in front of a screen, no? Taking up your lessons in front of the screen, and you're supposed to sit down for a long time. And you're supposed to focus on the screen, no? With very minimal interaction. One thing that is actually causing less stress sa atin when we go to school is when we see our classmates and our friends. We get to interact with them and talk to them during recess,
Yes.
during lunch breaks. Before and after school, nakakapagkwentuhan tayo. That in itself is removed or taken away from the students kasi they're just confined in their house. So that in itself is actually quite stressful for them. And aside from that, yung they spend a lot, meron din stressor sa bahay. Some of the students, going to school is one way of them relieving themselves of the stresses at home. And what more if nandun na lang sila
Agree.
sa bahay, di ba? So,
Right.
that in itself, unti-unting nagpa-pile up on the patient and on the kid. That's where nagkakaroon din siya ng myofascial pain syndrome. So, believe it or not, I do see patients, actually dumami lang sila recently because of the pandemic, na nagkakaroon din ng myofascial pain syndrome. They themselves undergo physical therapy.
Well, what I think are the three top, magano tayo, mag-ranking tayo, Mitzi, the three top conditions that you get to see more during the pandemic besides neck muscles cramps or whatever.
Neck pain, if we're going to if we're going to rank, actually I'm sure Dr. Lee, hindi lang po kami ang nakakakita, kayo rin po may mga complaints na ganyan, even other specialists and other doctors. I wouldn't give a ranking of top 3, no? I'll just give the most common.
Most common.
Myofascial pain is actually quite common. Myofascial pain syndrome,
Like
neck
mine.
pain syndrome. Yeah, in an elderly individual wherein degeneration of the spine sets in, they suffer from an aggravated cervical spondylosis or degenerative osteoarthritis of the spine. Another common would be low back pain. Low back pain kasi kadalasan nakaupo lang sila, and believe it or not, prolonged sitting is actually a risk factor for low back pain.
Yeah.
Kasi sasabihin nila, with sumasakit yung likod ko, Dok, wala naman akong binubuhat. Wala naman akong ginagawa. Nakaupo lang ako na matagal. Sabihin ko, that in itself is... Mitzi, mukhang guilty ka. that in itself is actually a risk factor. So, another thing that's quite common is actually upper extremity musculoskeletal conditions such as shoulder pain.
What about the wrist?
Pain
Kasi
and wrist
computer.
pain.
What about the
Computers.
wrist?
Yes.
Yeah,
Oo,
yung mga
nasa pa po.
computer, they get
Nako,
carpal tunnel
mga
syndrome.
nag-ML, Doki,
Yung
tsaka
mga
Netflix.
may hilig mag-video games. Yung mga even
Keyboard
non-office workers,
warriors.
even yung mga plantitas, they
Ah,
take care. Paminsan, pag titingnan niyo po yung bahay nila, parang gubat na sa dami ng halaman. Sobrang hilig nilang they want to take care, which is actually really
Mommy,
nice.
are you
And
listening?
which is actually really nice. And, actually, for me, I highly encourage them to get into a hobby. But some of them, they
Okay.
overdo it. They carry a lot of pots. Magdidilig sila ng halaman, they do a lot of overhead movements, thereby
right.
damaging their rotator cuff tendons and
Okay.
extensor tendon sa elbow. So, they will seek consult, sometimes e-consult with me. Elderly, 60 to 70 years old. I even had a patient, 92-year-old male, na napunit ang tendon dahil sa pagbubuhat ng halaman.
Oh my
Dahil
gosh.
ina-arrange
Oh.
niya yung ina-arrange
Oo.
niya para i-rotate daw sa sunlight exposure yung mga halaman
Oo,
niya.
oo.
So yun,
My
napunit ang
gosh.
rotator cuff tendon. We do get a lot of patients like
Yan.
that
So
during the
kasalanan
pandemic.
Doki ng halaman talaga.
Kasalanan ng
Yung mga mamahaling halaman na sumikat sa pandemya, yun yung mga they classify indoor, outdoor, pwede sa
Yes,
indoor,
yes.
pwede sa
Yes
outdoor.
po.
Ayan, di ba?
Yes
Mitzi,
po.
kaya yung
Yes po.
halaman, lipat dito, lipat doon. Siguro pwede lang sabihin
I'm
ng
worried
halaman,
tuloy sa
hilong-hilo
mommy
na ako.
ko.
Ha?
I'm worried tuloy kay mommy. Kasi ganyan na ganyan, Doc. Lipat dito, lipat doon.
Ano naman, it's okay. Actually, it's one way of making them active and making them move their bodies. But they should they should do it properly. So, what you would advise your mom, sasabihin mo sa kanya na take rest periods, rest breaks in between, wag
Right.
tuloy-tuloy. If masyado mabigat ang halaman, wag puwersahin, ask for help. Ask for help as much as possible. You use 2 hands when you're carrying. Wag yung isang kamay lang gaganunin nyo. Okay? And aside from that, di ba, yung proper back mechanics natin, ask your mom to use the bigger joints of her body to do a specific movement. Di ba, we have this notion na wag ka magbe-bend over to pick something up. Use your
Yeah.
knees. No, use your knees to pick something
Ah.
up. Do not bend
Parang
over.
naka-squat.
Yeah,
Yeah.
use your knees to pick something up. So that's one thing that you can ask your mom to do. And aside from that, yung mga, I'm sure your mom loves to watch a lot of series and movies. Am I correct? Nakaupo siya ng matagal. Tama po ba?
Parang si Mitzi yata.
It's,
Ako po
baka
ata
ikaw,
yun.
Mitzi, yung
Ako na yun.
masyadong So, believe it or not, watching television, watching a Netflix series is actually very relaxing. But we do
Yeah.
get patients then na nagkakaroon ng myofascial pain because of prolonged watching.
Pati
So what
yun,
I
Doc.
so what I usually
Sorry.
ask my patients then, sasabihin ko, ma'am or sir, huwag kayong uupo na masyado matagal. Limit your sitting ng 40 to 60 minutes, then you stand up once in a while and move your body. Because prolonged static position will cause spasm of your muscle. It will overwork your muscle. No? So, yun ang sasabihin mo, Ma'am Mitzi, sa sarili mo kung masyado kang pununood for
Nako,
several hours.
alam mo, Doc Ron, pag masyadong engaged, nako, they can sit hours and hours,
Yes.
di ba? But the thing what you're saying is like, I'm worried, especially if you have aging relatives, di ba, Mitzi?
Yes.
Because you sit, if you slouch too much, you get postures that will be deformed more, or kunyari meron na aggravating pa na kung ikaw ay bata-bata, edi tend to slouch because of, di ba minsan pag, di ba Doki, it's not nice also like when you're watching a K-drama, no, Mitzi, tapos nasa table, nakaganyan ka, di ba?
Yes.
That's
Yes.
incorrect because you want to be relaxed, but at the end of the day, they have to see you because the back vertebrae is in trouble na.
You're stressing yourself.
Yeah.
So, make sure that you're comfortable, seated comfortable in a very, actually, hindi naman kailangan mamahaling upuan. Basta as long as you're partially deweying your low back area. So, sasandal ka, Mitzi, huwag ka masyadong huwag ka masyadong
Yeah.
engaged doon sa screen. No? So, sasandal ka rin. And of course, very important, once in a while, you're supposed to stand up.
Yeah.
Okay? And Mitzi, wag puro K-drama and wag puro Netflix. Find some time to exercise. That is actually
Opo.
the number one thing that you need to watch
Na
out for.
sermon ka tuloy.
Opo.
Sorry, Mitzi.
Opo.
Ngayon
Yes
lang kami
po.
nakita ni Mitzi. But, di ba, I'm very much sure Dr. Lee is familiar with this. Nag-release ng guidelines ang American Heart Association, even the Philippine Philippine Heart Association, and there's a movement here in the Philippines which is called exercise is medicine. And
Mm.
in a well individual with no comorbidities naman,
Mm-mm.
or in a fit individual, the recommended is actually 30 minutes of moderate type of exercise 5 times a week.
Mm-hmm.
No, 5 times a week. Now, the moderate type of exercise, the easiest that you can do would be brisk walking. You can
Ayun,
just
okay
walk
yan.
around your house
Pasok na ako
30
dyan, Doki.
minutes. That would be okay. Pasok na siya sa minimum requirement natin. Now, Ma'am Mitzi, I know that you're really busy. I know that you're really busy. Sasabihin ng mga pasyente, Dok, wala ako makuwang time na 30 minutes na dire-diretso.
Mm-hmm.
It's okay. The 30 minutes, the recommendation could be given as an installment. You can do
Mm-hmm.
10 minutes exercise in the morning, 10 minutes in the afternoon, 10 minutes in the evening.
Mm-hmm.
So that's the nice thing about these new guidelines, and it's scientifically proven. No,
Mm-hmm.
installment based exercise would work and
Mm-mm.
would produce wonders for
Mm-mm.
your body.
Mm-mm.
No, so yun yung, of course, if you are not sure, I'm correct, Dr. Lee, no? If you're not
Mm-mm.
sure, if you have a comorbidity, it's best to see your doctor first prior
Yeah.
to starting any type of exercise.
Yeah. Ay, that's one
True.
I wanna ask you, no, Mitzi, di
Yes.
ba tama? Like, during the pandemic, we look at or we browse through, lalo na sila Mitzi, mga bata. You browse a lot through YouTube and other stuff, and you see a lot of exercise and parang short modules. I don't know what
Yes.
you can.
Oh, yeah.
Then, they teach you, di ba, Mitzi, teach you posture, ganon.
Yes.
Would you
Yes.
advise that patients who are having symptoms of what you have mentioned, neck pains, neck spasm, or lower back pain, to seek consultation to you before following the exercises sa YouTube?
Of course.
Baka idol lang nila yung gumagawa, natuwa na sila, sinunod. Baka lalong
Yeah.
lumala
Yes.
yung condition. Di ba, Mitzi?
Yes,
Yes.
Doc. Uso
Of
yan.
course,
Uso yan
no?
ng pandemic.
Gusto namin, syempre, if the patient is experiencing any type of pain in their body, it's best to seek consult from a medical doctor, not necessarily from us, from a medical doctor, just so that the patient can be properly evaluated. If the patient needs to be referred to us, then better, we can evaluate the patient. The thing is, if you're experiencing any type of musculoskeletal condition, aches and pains in your body, and you're going to do a certain exercise, baka lalo kang ma-injure. Baka lalong
Mm-mm.
sumakit yung joint mo, baka lalong ma-aggravate yung condition mo. So, I would advise you to seek consult from a specialist or from a medical doctor first prior to doing a specific exercise. Don't
Mm-mm.
worry. Us doctors, if you want to exercise, that's actually very good. Ang gusto nga namin ay nag-exercise ka. No? So we're just here to give you advice to do it safely and properly.
Yeah.
Okay?
Mitzi.
So ano ha,
Ay.
Ma'am Mitzi, do you exercise, Ma'am Mitzi? Ikaw naman ang tatanungin ko.
She sings.
Well,
She vocalizes.
I exercise my voice, Doc.
Okay, make sure
Well,
you
Doc,
do.
I used to.
Okay.
Like a year and a half ago. I'm very active po. As in, after school, I would go straight to the gym. Kasi yun yung naging ko, stress reliever po eh.
Yes,
Pero
yes.
when the pandemic came, my schedule was piled up na. Tapos ngayon, I'm reviewing. So, I need to have a lot of time in front of the screen. So, yun. Pero
Understand.
I'm planning po.
Yeah.
What about let's ask Mitzi, let's ask Doki, di ba? Yan. Kasi that's one. You don't seek advice from an expert. You watch it from a video. But
Yeah.
if you cannot follow at nagkamali ka, you might aggravate. Paano naman ito? Yung mahilig massage. Di ba, Mitzi? Magpamasahe.
Yes.
Magpatapak ng likod, no? There are people who step on your back and your sabi niya, oh no, we're gonna click on your vertebra. No, no, no. I go for massage before, but I don't like people, clicking my vertebra. So those who do that, do you advise them as a rehab and physical medicine man? Or this might aggravate things further once they seek your consultation?
Okay, actually, I cannot say if it would aggravate because the extent of what the massage therapist is doing, I really do not know.
Mm-hmm.
No, but my number one advice to the patients and uh, to everyone who's experiencing musculoskeletal pain, no, if the pain is really recurrent and it's such a way that it's chronic and it's affecting your lifestyle already, activities of daily living. And if you want to be really sure, um, it would be better to seek advice from a medical doctor first
Mm-hmm.
for safety purposes.
For
Because
safety purpose.
I'm not saying that massage is bad. Actually, we also utilize a similar type of therapy when we do
Mm-hmm.
physical therapy. No, I'm not saying that massage in itself is really bad. Actually, it's quite relaxing. But we do get cases wherein the musculoskeletal pain is aggravated by the massage. Pero most
Mm-hmm.
of the time, hindi naman na ano ito ng masahista, yung pasyente na mismo hindi kasi siya nagpatingin sa doktor Dumiretso
Okay.
siya sa ano, they went straight to undergoing treatment. And you cannot blame the massage
Yeah.
therapist kasi yun ang alam gawin
Yes.
ng massage therapist. So
Oo.
it's up to
Yeah.
you. You should take proper responsibility for yourself. So if you're experiencing any type of pain and you're really not sure and you want to be evaluated properly, seek the advice of a medical doctor.
Okay. Okay. Let's see.
Yes. Sa professional. This goes to dun sa mga ano hilot lang yan.
Yes, dahil
Hilot lang.
Mm-mm.
Yeah. Well, anyways, for the exercise talk, kasi ako, I love stretching and of course, I also love yung pamassage, yung nagpapatunog ng likod. Ako, Doc, when I stay for a long period of time in front of the computer, sitting, I do, seat exercises. Ano yung pinakita ko po kila Doc Joseph last Sunday.
Mm-mm.
Do you have a certain sitting position exercise that you can share with us
sitting
para sa
position.
mga matagal umupo?
Okay, for me, the number one sitting position exercise would be standing up. Cutting the
Oh, okay.
cycle of prolonged sitting. That would be one. Another thing that you can do, you can just stretch your neck area. Hold it
Yeah.
for
Mm-hmm.
6 to 10 seconds, then stretch the other part.
Mm-mm.
Okay. But of course, if you are not sure, kasi there are cases and there are patients wherein may problems sa spine and you don't want to
Mm-mm.
move it,
Mm-mm.
seek consult from a doctor.
Mm-mm.
Okay? If
Mm-mm.
you're a very well individual, these are the types of exercises you can do and
Mm-mm.
types of stretching that you can do. Okay? You can also do some shoulder shrugs.
Mm-mm.
Shrug your shoulders.
Let's do it, Doc.
Okay?
Oo,
So,
pinapagawa sa akin yun, ganyan,
yeah,
sa therapist ko.
those
Oo.
exercises are actually those would help relax the muscle, cutting the cycle of prolonged muscle spasm and static movement of your
Mm-mm.
muscle. But number one, Ma'am Mitzi, tatayo ka pag matagal kang nakaupo. Okay? That's one way of
Okay
reviewing
po.
your whole spine. You see now, di ba, the other
Mm.
workplaces, they modified everything. They have this chair or they have this table that can be pushed
Yes,
up.
lifted up po.
So lifted up so that they can type while they're standing. So
Ah,
marami ng modifications na ginagawa din ngayon. Okay, so
oo.
that's the importance of standing up.
What about yung mga hot pack, Doc? Hot pack that you place in the
Yeah.
shoulder, hot pack that you place
Yes.
at
Yeah.
the lower back,
Okay.
or yung mga cushions sa buttocks area na may mga kuryente or cold or di ba meron mga
Yeah.
ganon. Do you advise those stuff, especially
Okay. I
those
would
who cannot go to your clinic
yeah.
as a parang temporary
Yeah.
relief?
As a temporary
Relief.
relief first aid, everyone can do it if you're experiencing chronic muscle pain, which means
Mm.
muscle pain that's been occurring for more than 72 hours already.
Mm-mm.
You can
Mm-hmm.
put warm compress. No hot pack. Now, be careful with the hot pack. You might burn your
Ayan.
skin. You might burn your skin. So, better to put a cloth or a towel in between the
Yeah.
hot pack and your skin. Number one. Number two, huwag niyong ibababad sa hot pack ng 1 oras ang inyong mga balikat.
Ayan. Oo.
Walang significant difference. Normally, we prescribe 15 to 20 minutes only. No significant difference. It will be actually much worse for your muscle if you would expose it to heat for more than 20 minutes. So number one, yun yung precaution na binibigay namin. Another thing, do not lie down on the hot pack. You put the hot pack and you lie down on it. Baka pumutok yung hot pack, masunog ang balat ninyo. There are
Burn.
cases na ganyan. Yeah. So that's one thing. Another very important thing, learn when to use hot and cold
Yes.
modalities.
Yeah.
Okay?
Yes.
That's
Opo.
actually very important, very basic. I also teach medical students. Sinasabi ko sa kanila, ito lang ang pinaka-importanting gusto ko matandaan ninyo sa Rehab Med. And I believe, Dr. Lee, di ba, we also have some doctors who are confused when to use hot and when to use
Exactly.
cold. Di ba? Okay. In the acute phase of an injury, first 72 hours, wherein scientific terms, there is vasodilatation, mamamaga, there is inflammation in an injured joint. For example, Ma'am Mitzi, may kaibigan kang natapilok. Sana wala kang kaibigan na matapilok, ha? For example lang, natapilok, namaga yung tuhod. Tatanungin si Mitzi, Ma'am, ano ba ang gagawin ko? Natapilok ako. First 72 hours, we usually ask the patient to apply cold packs. Kasi we wouldn't want the joint to be severely inflamed. No, we want to control the vasodilatation. Kasi pag nilamigan mo yung joint, mas magko-constrict yung blood vessel. Mas magle-lessen yung maga. But this is good for the first 72 hours. So that's the first aid. Patients would usually ask us, gaano po katagal kung i-cold packs yung joint ko? Same, 15 to 20 minutes. Kasi more than that, magkakaroon na ng reflex vasodilatation. Napapansin nyo, pag masyadong matagal tayong naglalagay ng cold packs, namumula naman yung joint. Ibig sabihin yung blood, parang nagre-reverse na. Kumbaga, lalong nag-i-induce na inflammation on the joint. So, limit lang ng 15 to 20 minutes, but you can do it frequent. You can do it twice a day, you can do it 3 times a day. Okay? Now, after the acute phase of injury, after 72 hours, gusto naman natin na mag-heal yung na-damage na muscle, tendon, or ligament. So that's where the hot pack would come in. Because the hot pack would stimulate vasodilatation. It will help stimulate blood flow to the injured organ or to the injured area. That's why yung blood flow in itself will help heal the area in the chronic phase or subacute after the 72 hours. Okay? So yun. That's the first aid treatment that you can do. In cases of myofascial pain syndrome, Dr. Lee, there are studies wherein both cold packs and hot packs would help produce muscle relaxation. Given the proper dosage of 15 to 20 minutes. But then again, di ba, Dr. Lee, mas masarap ang mainit na ang hot pack.
Yes.
Yung lamig niya kakagulat masyado.
Yes.
But both have been shown to produce the same muscular relaxing effect. Okay? So that's the first aid that we can ask our patients to do.
You know, Mitzi, na when you hear Dr. Ron was saying like the time frame, no, you just get it like 10 or 15 minutes. Sometimes kasi when you overdo it, kasi sabi mo, wow, narirelieve ako. Pwede ba matagal? 30 minutes, 1 hour na lang. Ilagay mo lang dyan.
Yeah.
Like what Dr. Ron is saying right now, parang it doesn't take effect. Kasi the ones that the time frame is the minimum parang therapeutic for that you do. Pero pa beyond that, parang wala na. Parang magplapa. Minsan tayo, di ba, Mitzi, pag ordinary, ang sarap eh. Sige pa, lagay mo pa dyan hanggang ilang no? Yeah. Hindi pala tama yun, di ba?
That's the therapeutic dose, but you can you can do it frequent. If you want to do it twice a day, pwede naman. 3 times, pwede.
Okay. Right. Mitzi?
Okay. Right. So, Natawa na pumata tayo masyado sa ano sa mga first aid. But ano, I experience a lot na natapilok po. Lagi po ako natatapilok mga when I was around 17 years old, 18 years old. Tapos medyo yes, I have to admit nagkamali po ako dun sa pag-use ng cold and hot. Kasi before I had this notion na when you use the hot pack para mas gumaling siya.
Mm-mm.
Malamigin po kasi ako. So, inuna ko yung hot pack nun.
Lalo
So, in the end,
namamaga.
opo, ang haba tuloy nung span na hindi pa ang
Healing.
haba opo, yung
Oo.
healing niya. Yun. My gosh, ayun. So, yun po. Pero, after that naman, I was properly educated. Yun. So, ayan, first 72 hours more on
Cold.
cold daw po, and then after that saka po mag-hot. Okay. So does that go, Doc, kapag gusto mong ma-relieve yung eyes mo? Cold or hot po ba dapat?
For eye relief, better to ask an ophthalmologist regarding that. But
Oh, okay.
yeah, but both I believe there are small muscles in the eyes also. No, some patients they apply. Of course, you don't want to burn sensitive ang skin dyan sa eye.
Yes,
And putting
opo.
pressure on the eye may cause baka magka-retinal detachment ka. So do not put pressure on your eyes. Better ask an ophthalmologist regarding advice on applying cold or
Alright.
hot in the eyes. No? But it's safe naman kasi 'di ba for mga pasyenteng may colitic, may sty, we ask them to put one compress. So if it's properly prescribed by a doctor, again, I want to emphasize, have yourself checked by a doctor prior to doing anything to your body, just for safety purposes.
Okay.
And of course, Mitzi, di ba? Like what Dr. Ron said, no, we just have to remind them, our viewers, like what you have mentioned, can this the rehab or physical medicine be for people who are well, who doesn't have any chronic pain and everything. Like what Dr. Ron said, pwede, no? Hindi lang exclusive ito sa mga nagkakaedad. Kasi yun ang wrong notion, di ba, Doc Ron?
Yes.
Rehab, pang matanda, na aksidente, stroke persons, di ba? They do
Yes.
all these the machines that you let them do, no? But you cannot, people who are well but already have starting or progressive pain like muscular spasm, they are allowed to seek in your department, right?
Yes, of course.
Yes.
Of course.
Mm-hmm.
Ano tayo ang specialty namin, we treat from pediatric patients up to the geriatrics. Sedentary patients, athletes. Lahat po yan halos dumadaan po sa amin. So, persons with disabilities, mga amputee, actually that's the nice thing about our specialty. We get to interact and treat wide array of patients.
Yeah.
Yeah.
Alam, di ba, Doc, our episode today, it's connected to our episode last Sunday because Doc Ronald, we actually had a guest last Sunday and naman, all
Cryotherapy.
about, opo, cryotherapy naman. I think it's under your din po.
Oo.
Yun. So,
Because they were using, Mitzi, no? They were using
yes.
Doc Ron freeze chamber.
The cryo chamber.
The cryo chamber in order to dissipate pain and relieve pain.
Yes.
Do you have that? Do you agree or disagree?
Actually,
do you have this concept of they put you into the first chamber kasi is negative 10 and you transfer to the next chamber of negative 60, then the last chamber for 2 minutes it's negative 110. Then you go down climatizing downwards. So it makes it relieves the pain. As a rehab in the doctor, do you advise also those two?
It's the same principle with the cold packs that we're giving. Because the cold packs it produces a local analgesic effect. thereby it
Mm-mm.
relieves pain. But for our specialty kasi the use of the cryo chamber, most of the time we use it on athletes who are trying to
Ah.
recover faster. Because, di ba, yung mga athletes natin, bugbog na bugbog masyado yung katawan yan eh. And it's not just one sporting event or one game that they need to play. They need to last for the whole season. They need to
Alright.
play as much games as possible. So that's
Mm-mm.
where this cryotherapy and cryo chamber would come in.
Mm-mm.
Because the cryo chamber would help them recover faster. Kasi di
Alright.
ba, of
Right.
course, if you expose the, di ba, Ma'am Mitzi, kung nanonood ka ng sporting events in basketball or nakikita mo, di ba, right after playing, nilulubog nila yung sarili na to ice.
Yes. Actually,
It's the same
Doc, I'm a player and
Yeah.
I do experience that po after
Yeah.
our game.
Yes, in order to reduce the accumulation of lactic acid and or in order
Mm-mm.
for our
Mm-mm.
body to recover faster, nilulubog talaga sa ice yung mga athletes natin. So, ano yan, di ba sinasabi ng matatanda, yung pag masyado ka na overuse, huwag mong babasain yung kamay mo, huwag ka maghahawak ng
Yeah, opo.
malamig kasi baka mapasma ka. It's actually no scientific evidence with that kasi even the athletes nga, nilulubog po natin sa yelo and we
Yeah.
ask them to go to a cryo chamber just so that they can, of course you have to be very careful. This has to be done in a proper setting with proper medical supervision. Baka mag-frostbite yung pasyente.
Right.
So it should be properly prescribed and properly monitored. At the same time, if the patient is not used to such treatment and hindi sila nasasarabat, don't force the patient to undergo such treatment. But the cryo chamber in itself is actually quite helpful in our practice and especially in the treatment of athletes.
Yes,
Mhm.
okay. Last question na lang siguro, Doc,
Yes.
before we let you go.
Oh yeah, what time is it na ba? Oo nga, it's ano ba?
We
Napasarap ang
enjoyed.
kwentuhan natin.
Oo nga
Oo nga
eh.
po.
Yeah, I need to see patients pa pala later, sorry. Yes,
Oh
what's
my
your last
gosh.
question? It's okay, no problem.
Okay po. Doc, kasi I mentioned I'm a player po. I'm a women's basketball player. So,
Oh wow,
meron
okay, that's
kaming
good.
Opo, meron kaming belief kasi na kapag natapilok ka sa game, itakbo mo lang 'yan. Okay lang, okay na rin yung paa mo after. Is that okay po ba?
That's not always the case.
Oh, okay.
I also see that in football games. The commentator, the coach would usually ask the player, just walk it off and it will be fine.
Yeah, opo.
But ang ankle sprain kasi, there are several types of severities ng ankle sprain. We usually grade them. In severe cases, once you do it, if you will notice, Ma'am Mitzi, di ba, yung ankle mo, pag nakatiptoe ka, mas loose, mas malambot. As opposed to, pag pinoint mo yung toes up to your head. Nakita mo, di ba, parang mas stiff yung ankle mo. Mas hindi siya
Yes.
gumagalaw. Correct? Okay.
I'm actually
So,
touching it now.
yeah. So you can actually touch it. Ang position kasi ng nakatiptoe, that actually is the position of laxity in the ankle. And that's the time wherein the ankle gets injured. Lalo na when you're playing basketball, di ba, nagkamali ka ng landing, instead of gumanon yung paa mo, nakatiptoe ka. So, nasi-sprain mo yung ankle. Pag na-sprain mo yung ankle mo, there are several things that could happen. Number one, pwedeng mamaga yung ankle mo. But the most common thing that would happen would be, napunit mo yung ligament mo.
Oh gosh.
Yeah.
There could be a partial tear or a full thickness tear. Okay. Now, another bad thing that's a lot more worse than that would be naputol yung tendon, an avulsed tendon, or a fracture or an avulsion fracture. So those are the things that could happen when you get an ankle sprain. So it would be better. I did work then before in when I was undergoing rehabilitation medicine training. We worked a lot with athletes. So during UAAP games, nandun kami sa sideline. Pag may natapilok, we don't immediately ask the player to go back. We assess the patient properly. Kasi if napunitan siya ng ligament, baka lalo mag-worsen. What more kung na-fracture siya tapos pinatakbo mo pa rin? baka lalong dumayo yung bone fragment, lalo mag-worsen yung fracture.
Mhm.
But either way, kung may fracture ka, Mitzi, hindi ka naman na talaga makakatakbo.
Oo nga naman, Doc.
True.
Iiyak ka na,
True.
iiyak ka na sa coach, sabihin mo, coach, hindi ko na kaya maglaro. So, hindi na talaga kaya. But that's the advice that I'm sure marami rin makikinig sa atin na recreational athletes, mga sumasali sa liga, na may mga coaches, and basketball players. If you get an ankle sprain,
Mm-mm.
always remember, di ba, meron tayong mnemonic yan, di ba, Dr. Lee? Rise, but now it's price. You need to protect the joint. Yeah, you need to protect the joint. You need to rest the joint. You need to ice the joint and elevate. Okay? Just so that wag lang mamaga. And very important, seek medical help. Pa-check nyo sa doktor para malaman kung ano ang tamang gagawin. If kailangan mag-request ng x-ray to check if there's any fracture. So, those are the things that you need to remember.
Where can they see you? Doc, diba, Mitzi?
Yeah.
If people will chat to us or PM us, ay, ang galing ni Doc Ron mag-explain. Gusto ko magpa-rehab.
Yeah.
Oo. Where can they visit you?
I have a clinic in HealthCube Medical Clinic sa Shaw Boulevard. So
Yes.
I'm not allowed to say my schedule here due to medical ethics. Just ask them to call the clinic.
Ang ganda ng rehab nila dyan. Oo, napaparehab ako dyan. Di ba, Docky?
Yes,
Sabi
it's
ni
very
Doc,
nice facility.
Alright, so everything's duly noted, Doc. Doc Joseph and I will really take note of everything. Alright. So, okay, we have now come to the end of our interview. So, before we let you go,
May
Doc,
surprise kami sa'yo, Doc Ron.
yes, of course. In return of your presence here in the Sunday Health Show. And of course, for giving your time today, this Sunday. And as you mentioned, you have patients pa later po, no?
Unfortunately, yes. We're very busy ni Dr. Lee. We work even on Sundays.
Oh my. All right. So, we would like to present to you the Sunday Health Show's virtual certificate of appreciation. Ayan. Yes, so the certificate of appreciation is awarded to Dr. Ronald Christopher Cua in recognition of his commitment to health, for sharing his valuable knowledge and time as the episode guest on Rehabilitation Medicine during COVID pandemic on Sunday, December 19, 2021. Signed, Director Mitzi Aguinaldo, Producer Dr. Joseph Lee, and Mr. Pocholo de Leon Gonzalez. Thank you so much, Doc.
Thank you very much. Thank you very much for inviting me. It's such a pleasure. See you soon. Thank you.
Yes.
Yeah, see you soon, Doc.
You're part of
Alright.
the archive already, or our edit, what you call that, directory. So we'll try to invite you anytime soon if we have episodes that people want to ask about physical medicine and rehabilitation medicine. Okay.
No
Thank you,
problem.
Doc Ron.
I'll be happy to be back. Thank you.
Yes. All right. Okay. Okay, guys. So, thank you so much, Doc Cua. Wag po bibitaw at heto na ang last ganap for today. What's your baon for today? Hello.
Hello again.
Hello, team.
hello.
How are
Yes.
you?
Sino to, Mitzi? Sino ang mga sinasabi kanina ni Doc Ron, lahat meron ako. All of the above. Si Doc Freddy, ikaw ba yan? Tayo ba? Meron ako niyan.
Medyo, parang isa lang yata yung ko doon. Meron lang akong isang shoulder pain.
Yes.
Yes.
Oo.
But as of now, wala naman akong nararamdamang iba. Then, parang may isa dyan. Yung, kung sino pa yung
Sino?
pinakabata.
Oo, sino kaya yun? Sa taas ko ba yan? Yun sa taas ko.
yung ano, yung 20-year-old
Ay,
pero
or dito sa kabila.
50-year-old
Dito.
totoong yung nandito to.
Hindi, di sa kabila. Ayun. Di pa na. Dito.
Nabiyayaan ng lahat.
Yun nandito sa taas ko.
Oo, yes. So, actually, ako kasi, MPS talaga, no? Muscle pain syndrome, no? It's very common here. We call that, neck pain, no? Kasi I want, especially sa OR, when I stoop and I do things. That's why I don't like going online very long or watching a lot of, because when I stoop, it tend to stress. So, pag yung sumasakit yung, triangular muscles mo at the back, right? Very uncomfortable, nakakabuisit siya. Sorry nakakainis siya. So I have to go to rehab
Yeah, that's
talaga
true.
to have it yung ultrasound, hot pack. Tapos they have to do treatment on the para kung hindi sinabi ni Mitzi ni Doc Ron kanina, ang bigat-bigat, parang pasan mo dalawang sako ng bigas sa mo,
Opo.
shoulder mo.
True.
Diba, Freddy?
Yes, tama, Doc. As in.
Ikaw, Mitzi.
Ay, parang Doc, no? Talagang investment din yung kapag rehab. It's really needed. Parang na-overlook natin siya na rehab, this is just for those who need it, yung may mga illness. Pero kahit yung mga well, I can't consider myself na well. Kasi, for those who are well.
Aminin daw, sabi ni Freddy. Aminin.
Yun. Ayun, for those who are well then, they can also really have rehab. Parang siya, it's for everyone talaga. Kailangan mo siyang i-add para mas gumanda pa yung actions mo. I mean, mas umokay pa yung being mo. Yun.
Ito kasi
So,
minsan
how-
yung department or specialty na less visited or less known for some reason because they felt na, di ba tinanong ko Gian kanina, ay baka pang matanda lang, hindi pwede pang bata. Parang kunyari gusto ni Gian pumunta, pwede ako magpa-rehab? Ano sasabihin sa'yo ng kasama mo, Gian? Ay, matanda ka na ba? Di ba? Kasi ang unang sabi, papa-rehab ako. Di ba, Freddy? Ay, hindi. Sinamahan ko lang yung lola ko. Ay, talaga. Tapos
Di
ikaw
na
Yeah, when
wala
you
ka
hear
pa
rehab,
therapy.
it sounds parang it's already related to
Oldie.
drugs.
Geriatrics.
Diba? Diba?
Yes. But
Yun.
ako
Yung
kasi
iba
I
kasi-
do I do it weekly. And it tends to relieve me the occurrence of the spasm kasi bata pa kayo, I don't know if you can experience. Kasi ako talaga nagno-nodule siya yung lactic, siya, Mitzi, ang sakit. Talagang
Yes.
it really once it's there, it can go up to the neck, it goes to the head, and you get migraine.
My gosh.
Mm.
Imagine kapag walang kapag walang treatment doon. Nako.
Oo,
Good luck.
tapos yung feeling mo pag yung therapist mo, Gian, tinitreat ka, ay, sige pa, ang saya-saya, ang sarap, ganun. Alam mo, parang patayin mo lahat ng mga alien, insekto, mga ganyan, alam mo. Diba, Freddy? Ganun ang
Tama, Doc.
Diba? O kayo
Yeah.
naman, anong ninyo ba? Ako na nagsalit.
Ako,
Sige.
I'll share.
Sige, share.
Sobrang nakarelate ako sa sinabi ni Doc kanina, actually sa lahat. Kasi,
All of the above.
no, I've experienced it. First, I have mild scoliosis. And
Okay.
second, I was with my mom when she had her therapy when she had a mild stroke.
Okay.
So first, ang ginawa sa akin muna. Pumunta ako sa physical therapist doctor, tapos binigyan niya ako ng specific exercise na kailangan kong gawin. But bad patient yung ginawa, so medyo dumala. Tapos with my mom, yun yung sobrang ang laking-laking tulong talaga kasi when she had her mild stroke, nung na-treat na siya sa hospital, after nung treatment for everything else, we need to work on her movement. So, yung kamay niya dati, ganito lang. Hindi niya ma-close fist. So, ang first, after nung stroke niya, prior to going to physical therapy, ganyan. As in, kahit anong gawin niya, hindi siya
Hindi niya
mag-close.
ma-close.
Hindi niya ma-close.
Oh.
Tas, nung nagpa-consult doon sa physical therapist doctor, binigyan din siya ng specific exercises and routine na kailangan niyang gawin every couple of days in a week. So, for a couple of months, we went to therapy. Tas doon nag-exercise siya from doing little exercises, to routine movements. Tapos after nun, ang laki ng improvement. Kasi kung dati ganyan lang yung pag movement niya, naku-close na niya from ganyan to ganon. Tapos yung movement niya nag-improve talaga. When she went back to the hospital, yung mga nurses, doctors, and tumingin sa kanya, nagulat kasi yung movement na nagagawa niya dati and after nung therapy, sobrang laking diferensya. And nag-glow. I don't know why, but siguro dahil sa circulation ng blood, but nagkaroon siya ng certain glow. Ayun lang, wala nang share.
Parang glow as in blooming, gano'n natin?
Yes, oo, blooming. Kumbaga, parang dati, parang siyang ewan ko, siguro,
See?
dahil
Tama,
sa...
nagte-therapy ako.
and also, yung will nung patient, malaking bagay din siya. Kasi kung halimbawang medyo hindi talaga ganun kalakas yung loob, medyo matatagalan yung
treatment,
healing.
yung healing niya.
Yung treatment. But yung will ng patient to get better, mas makakatulong siya for the patient to recover.
Maganda yan, Gian, no? Mitzi, Freddy, na dinala nila Gian for therapy because these are fine movements. No? The hands have fine movements. This is where you hold your pen. This is where you pick up things, diba? So when it's not gross like yung upper arm and forearms natin. Now, when your fine movements are affected because of stroke, they tend to have less of the mobility later on to do things, no? At maganda na pa-therapy niya gradually and they actually nag-improve, which is very, very good, diba? May iba kasi yung sinasabi, Mitzi, pinapabayaan na, okay na yan, sa bahay na lang. Sa bahay kasi, hahawak ka ng bola, hindi niya mahawak, wala na, ayaw niya. Alam mo sa Freddy, sa rehab, pipiliting ka nilang gawin yun. Kahit
and
na ayaw mo.
And
monitored by therapists.
Licensed physical therapist, yes po.
Yes.
Alright.
That's good.
How about, Sir Freddy? Baka may kwento si Sir Freddy, rehab. Kwentong gano'n. Sir, naka-mute po kayo.
Ayan, okay na ba?
Ayan. Yes po.
Yes. At a very early age, parang sa mind ng lolo namin, sinabihan na kami dapat hanggang tumanda kayo, mag-exercise kayo. Hanggat kaya nyong abutin yung tuhod nyo, dapat nyong gawin yun. And at the same time, nung mga yes. Ang lolo namin, niya, ko lang, sample ko lang. When we were still young, pag magbabasa kami ng libro, may ilalagay din siyang libro sa ulo mo.
Ala.
Para ma-maintain mo yung
posture.
posture mo. And at the same time, pag may pupulutin ka, dapat yung paa mo, especially yung, di ba, yung balance mo is nasa gitna bago ka bumaba. Yung ganon. Hindi ka dapat, wag mong itiklop yung likod mo or wag kang mag-bend. Bumaba ka pag may pupulutin ka. Nandun pa rin yung libro sa ulo namin. Ganyan. So, nung nag-join ako sa nursing, yun yan, mayroon tayong posture na pinag-aaralan. Lahat ng pag-ikot mo, dapat mong gawin yon para hindi ka naman, di ba? Nakita nyo ba may mga nasa medical, ang pangit man kung nasa medical ka, parang ganito, oh. Ano pong gagawin po natin? Di ba? Ang pangit naman yung presentation ng pag-guest. Di ba, Doc?
I love you. Talaga. Kuba,
Di ba?
flashback ka ba? Ganon?
Yes. Di ba? Para ang pangit naman nung nagpe-present ka or
Mas
sasabihin
maganda
mo,
straight.
nagbibigay ka ng gamot nanginginig yung kamay mo, hindi mo na
True,
Yes.
true.
Yan. So mula pagkabata ko po talaga, yun, may exercise na akong ginagawa. More na stretching, ganyan siya.
Parang si Mitzi.
Yun nga lang, syempre, iba pa rin yung nagkaedad na tayo, mayroong mga pain na hindi natin maiwasan, pero at least minimal naman siya. Yeah.
Kala ko
Importante
meron mga tips, 'di ba? Tips ang lolo niya, Gian, Mitzi, pag may pain, anong gagawin mo? Maglagay ka dito ng mga bowl, parang ganyan.
So yun, maintain pa rin ang di ba? Kahit walang sandalan, naka-straight body ka pa rin.
Pero
Ganun siya.
pero Freddy, hindi ka kumakain, military, parang ganun. Wag na, ganun rin ba?
Hindi naman po, basta yung may ganong cases, pero kung posible, pag nandyan ka sa work mo, yun, naka-stretch ka lang or kasi pag ganyan ka, di ba ang sakit-sakit ng katawan?
May counting
This is straight.
May counting
Meron
pa
pa nga
yan.
nakatali po sa sa chair. Nakatali sila. Tapos kailangan yung mga yes, Doc, may napanood ako yung sa mga proper etiquette before, talagang nakatali.
What?
Yung nakatali sila sa chair.
Spanish style.
Opo, hindi
Baka
sila
pang
pwedeng
royalty
gumanon. Parang
royalty.
yon, ganun, Doc. Parang mga ganung area. Ako
Royalty
nakataas
kasi
pa yung
kailangan
paa ko.
ganyan Oo. How you sit, how you posture, 'di ba? How you don't slouch, 'di ba? There's a way of
Then, maidagdag din po ako, mayroon ako naging teacher din dati. Sa English teacher namin nung grade 6 kami. Ano din siya, talagang pag nakaupo ka, dapat straight. May na-minusan yung grade mo, parang ganito. I will give you perfect grade, it's 100. Pag nag-slouch ka, -1. Okay? Dapat straight ka ulit, ganyan. So hanggang matira, yun ang grade mo sa kanya.
Oh my God.
Ay, grabe.
diba?
Bago matapos yung klase, ubus na ang sa kakamay
Ayun.
mo.
Pero talagang po, hanggang po namin yung teacher namin, hanggang nag-graduate na kami sa university, pag nakikita namin, naalala namin, straight body talaga siya, tumanda siya, pero hindi talaga siya, ganda ng posture niya.
Ay,
Yung ganong
ganon.
cases. Yun na mga natutunan sa mga lolo at mga teachers. Kaya dala ko pa rin hanggang ngayon.
Yes, maganda yan, Sir Freddy, kasi yung nakasanayan mo na, pagka hindi ka nakagaya ko na Cuba, and kailangan pang pumunta sa doctor para makorek. So sa'yo, from the start, corrected na siya and maganda.
Alright.
Kailang salamat din kasi minsan din may mga nasobrahan naman, di ba? Lordosis. Scoliosis, lordosis. Wag lang masobrahan din.
Oh my God!
Di ba, Doc?
Freddy, mga banat ni Freddy.
Ay, nako. May. Ako naman po, stretching. Stretching talaga. Mahilig po kasi talaga ako mag-workout kahit pa nung before. Ngayon lang talaga natigil. Ito po yung longest time na hindi po ako nag-workout. Yun, stretching, yun talaga yung nagpapa-relieve sa akin. And, nagpapa-feel na I'm very able to work well. Yun. So, yan. So, we've heard it all from everybody. But before we leave, Doc Joseph and Sir Freddy, may sabihin po ako. May nag-birthday po. Noong December 17 and na-miss out natin. Opo! Si Ate Jihan.
Yes,
Happy birthday.
Yes.
Bakit na-miss? At dahil dyan, nako.
Happy birthday, Ate Jihan.
Thank you guys. Ano na ako, Doc? 21 years old. 20
Wow.
years
21.
Wow.
That was 20 years ago.
Ay,
I'm
ay,
actually
ay.
41 now.
Okay yan, you still look young and beautiful. Okay yan.
O, diba?
Yeah.
Diba?
Ayan. So, happy birthday, Ate
Happy
Jihan.
birthday.
Thank you
Ayan.
guys.
Yeah. Thank you so much for your for all of
Kinabahan ako
your
dyan.
produced
Sasa-
videos.
Kinabahan ako si Mitzi.
Sorry, Doc.
Parang yung prostate ko, Freddy, gusto umakyat ng tonsils ko. Meron ako, alam niyo, may sasabihan, mga ganyan. Ako,
Magkita talaga.
Sorry.
Para ang layo ng Doc, ah.
Ayan.
oo nga, kinabahan.
Saan dumaan?
Naguling ako bataan siya.
Ang gonads napunta sa leeg. Ala, grabe.
Okay. So,
Sige.
Ate Jihan, what's your wish pala before we end? Ayan, wish.
Wish?
Secret yan, secret.
Secret. Pero yung
Aww.
okay, sana hindi na ako maging marupok. Sana makain ko na yung
Ay,
gusto kong
grabe.
kainin
Ayan, alam mo,
na
gusto ko
bawal.
sa video, Freddy, may mga hashtag ni kanina. gusto ko
Marupok
sabihin,
yan talaga. Ayan.
Wala pa lang.
Oh, diba? Alright. Oh, sige.
Sige.
Okay, so it's now time for our plug-ins. So, simulan po natin kay Doc Joseph.
Yes,
Ayan.
you can see me sa YouTube ko, Dr. Joseph Lee, Urologist, diba? Please subscribe and yon. Then, meron din ako sa Instagram, Dr. Joseph Lee. Yun lang.
Ayan.
May tag Instagram. Me. YouTube and Facebook, Adobox. Oops, sorry. YouTube and Facebook, Adobox and Adobox. And thank you to Kit and Company for their organic soaps. And birthday din ng daughter ko yesterday, December 18. Magkasunod kami. Happy birthday, Blair. I love you. I'll see you later.
Yes, sa akin naman, YouTube, Instagram, Facebook, isa lang po, The Mellow Voice. Yan po siya.
Yun.
Maraming salamat po.
Yes, and ako naman po,
Ito, marami
YouTube,
ito.
Facebook channel, Facebook page, Instagram, TikTok, and yun lang naman po. Kumu, yun lang. And of course, don't forget to like and follow the Sunday Health Show. At saka thank you po pala kay Kuya Harold, the husband of Ate Jihan. Siya yung nagpaalala sa akin. Ayan, shout out daw. Thank you, Kuya. Ayan, tumutulong, Doc Joseph, tinutulungan po pala tayo ni Kuya Harold din sa health show. Siya minsan yung nagda-download ng mga videos na kailangan i-present. Ayun. So, okay, Ate Jihan?
Yes, and see you next Sunday. Pero bago matapos ang lahat, binabati rin po namin ng maraming salamat ang aming mga sponsors. This program was brought to you by Eric Lee, Natural Spring Water, Genesis Organic Spirulina, Salvicare Coffee,
Trilodent Gold, Emergency Rapid Assistance Application, and Asian Hyperbaric Healthcare Institute. Thank you po. Thank you for believing in our show.
Yun.
Ayan.
Next year na mga package yan. Tapos, ang mga Gcash ninyo, ha? Ang number ibigay sa akin, ha?
Ay, grabe.
Oh my
Merry
goodness!
Christmas, Doc.
Merry Christmas,
Sesame na.
Doc!
Saan ko na?
Ano,
My
digital
gosh.
na digital na
Ayan.
ngayon.
Grabe, napakabilis na ngayon, no?
Oo nga. Sabi nga ni Freddy, ang bilis ko. Ang bilis mo. Sa Kuwait ka, diretso.
Buti na lang may Gcash ako.
Ayan.
Okay.
Okay, o sige. Last but not the least, shout out po natin ang Certified Voice Artist program, kay Voice Master, Mr. Puchola de Leon Gonzalez, sa aming station managers, Sir Richard Abelos, and to our home station, VG8 Radio. Maraming salamat po. And see you on December 26, and after Christmas Day. Magbabalik po kami for our last episode. Yes, napaka-exciting. And
Alas na ba yan?
yun, dalhin niyo po yung mga alaga niyo.
Oo. Nako si Gian, oo.
Si
Pwedeng
Jackson.
alam mo, Gian, pwedeng stuffed toy.
Stop!
Hindi, yung human stuff toy ko na lang yung madalas naliligaw pag nagsushow ako. Yun na lang dadaling ko.
Alam mo, marami to. Alam mo, Freddy, ang dami nitong hashtag slash.
Grabe,
Oh my
Doc.
gosh.
As in.
No,
Usual.
Freddy. Kailangan natin ito hot seat natin sa last day natin.
Ay, siya. Pwede yan.
Oo,
Ayan na nga
Freddy,
ba?
Siya ang ating object of joy next natin.
Yes.
Object of joy! Oh my gosh.
I'm sorry.
Okay.
Okay, guys. So, all together po. And this is the Sunday
Health
Health Show. Thank you, guys. See you next week.
Go, Mitzi.
Okay.
Yes, it's a good yellow Sunday.
Hello, good morning po sa inyong lahat. Magandang umaga. Welcome back sa show kung saan health is wealth, the Sunday Health Show. It's another Sunday yet again to share a new set of health information to our beloved viewers. Ang bilis po talaga ng panahon.
Magandang umaga sa inyong lahat. Mula sa inyong tagapagbalita, ito si Freddy, the Mellow Voice. Bago sa ating mga balita, alamin muna natin ang mga bilang ng kaso sa COVID-19. Alam niyo ba umabot na sa 235,417,000 at 4 ang world population ng COVID-19?
Good morning! It's time po para sa word for the day, and the word for the day is pharmacology.
Sa mga medical app naman natin, pwede natin gamitin ang Fujifilm.
Ang mga benepisyo kapag magpa-consult sa licensed doctors ay may e-prescription, e-laboratory request, e-medical certificate, general health info, proper medication at sa mental health. Lahat ito ay gamit ang online communication at the comfort of your home.
Oh, okay.
Tumataas, bakit nagkaroon ng pagkakataon magpa-cosmetic surgery?
Younger than 12, usually I would advise them to still continue.
You have to know everything kasi I've been practicing it for almost 21 years, no?
Then the reassurance is there na anytime when you feel ready to open up, andito lang ako to really listen. Ayan na. Ding, 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 ding.
260 ml and we have yung 12 ml mouthwash sachets. And
thank you for making this platform wherein, medical health as well as mental health
Yeah.
and incorporating it and reaching out to others is something talaga, tama nga si Doc kanina, it's something that we need right now. Instead of giving fake news or fake information, eto dapat subaybayan ng mga tao because this is the health and wellness information program that is suitable for everyone. Thank you, thank you, thank you.
Masaya ako dahil napaka-productive ng ating usapan at talagang live, no? We can share without any hold bars, no? At sa ating mga listener.
Thank you very much.
Yeah.
I enjoyed too.
We're glad po.
Nagulat ka?
Thank you, Sir Freddy. Mag-iingat ka parati dyan. PPE ka parati.
Ayan na, nag-ayos na siya.
Ayan na.
At the bottom of my heart, I felt like I'm really connected with Sunday Talk Show. Alam ko naman, kahit malayo ako dito, I feel na we are interconnected as family. At yung pagbibigay ni Doc ng kanyang message, I felt na, yun nga, natamaan ko yung, yung
Iiyak na yan. Being a medicine man is a gift, no? It is a gift given by somebody higher, supreme being. It is not always that you tell yourself that you're so entitled. When you say so entitled, parang, ay, ako na ito, ako na magaling, ako na nag-training, and it. No. Somebody higher than you can take that away very easily and very quick from you. So you are given that gift to heal as an instrument because hindi mo rin alam up to when is the time of your healing. Siya lang ang nakakaalam, di ba? Pwede ang may taas, may kapalang nakakaalam kung kailan ang time ng isang tao.
Sabi nga kanina nung isang comments, we need more people like him, like you also, Doc Joseph. Diba?
Yeah.
Kailangan natin ng mga ganyan na tao, of course, lalo na yung mga health professionals na hindi ginagamit yung kanilang profession para lang maka-earn ng money o wala. They are really doing it for the betterment of the people. And this is the
The Sunday Health
Show.